Did you know that although it's an incredible resource for many, there are cases where magnesium might not be the ideal solution and might even worsen the situation? Let's talk about a super relevant topic for those looking to improve sleep quality or reduce anxiety: the use of magnesium. Have you ever bought magnesium thinking it would solve all your sleep or anxiety issues, only to find it had no effect or, worse, made you feel more agitated? This can happen, and I'm going to tell you why. Magnesium is renowned for its ability to soothe and lower levels of cortisol and adrenaline, hormones that are directly linked to our state of alertness and anxiety. But here's an interesting thing. Not all sleep and anxiety issues are caused by a lack of magnesium. For example, if your insomnia or anxiety is caused by emotional stress or professional concerns, simply increasing magnesium intake might not bring the expected benefits. Moreover, some people may have different sensitivity or even a condition that causes magnesium to act in the opposite way, leading to more stress instead of relaxation. It's like trying to put out a fire by throwing alcohol instead of water. Therefore, it's essential to understand the true causes behind your stress or sleep problems before deciding to supplement with magnesium. So, if you've been through this or are thinking about using magnesium, think about how you can investigate other possible causes for your symptoms. After all, knowing the problem well is the first step to finding the right solution. But did you know that there are basically two major groups when it comes to sleep difficulties? Let me explain each of them so you can understand better. The first group includes people who have difficulty falling asleep. If you lie down and fall asleep quickly, it indicates that your parasympathetic system is working very well. The parasympathetic system is that part of our nervous system that helps us relax and enter a deep state of rest. It is essential for the initial phases of sleep, those in which we truly recover our energy. The second group is formed by those who can fall asleep, but have problems maintaining sleep throughout the night. They often wake up, for example, at 2 or 3 in the morning, feeling more alert than during the day. This is often linked to an imbalance in cortisol and adrenaline levels, which should be lower at night to allow for peaceful sleep. When these levels are high or unregulated, sleep is interrupted, leaving the person tired and unrested in the morning. Knowing which of these problems affects you can be key to understanding how magnesium or any other intervention can help. If you have difficulty maintaining sleep, for example, you may need strategies that help regulate your cortisol levels, rather than just supplementing with magnesium. This clarity about the specific type of sleep problem you face is crucial to personalize the approach and really find a solution that works. After all, each body reacts differently, and understanding yours is fundamental for better nights of sleep. An important point we need to address is how to identify if there really is a magnesium deficiency. This is more complicated than it seems. Let's understand why. Most of the magnesium in our body is not in the blood, but inside the cells. This means that when we do a blood test to check magnesium levels, it may not show the complete reality. Unless you are extremely deficient, standard blood tests may not detect minor insufficiencies that can still affect your well-being. Therefore, if you are thinking of supplementing magnesium because you feel anxious or have sleep problems, it is crucial to consider this issue of testing. It may be that, even if the exam says your levels are normal, there is still a hidden deficiency contributing to your symptoms. The best approach is to combine the results of the exams with an evaluation of your symptoms and dietary habits. If you do not regularly consume foods rich in magnesium, such as green leafy vegetables, nuts, seeds, and whole grains, or if you have a lifestyle that can deplete the body's magnesium, such as high stress or high alcohol consumption, it may be wise to consider supplementation, even if the tests do not indicate a clear deficiency. This dynamic is essential to making informed decisions about supplementation and ensuring you are really taking care of your health in the best possible way. Have you ever stopped to think about how much what you eat influences the amount of magnesium in your body? Foods rich in magnesium include green leafy vegetables such as spinach and kale, nuts, seeds like pumpkin and chia, and even dark chocolate. Consuming a variety of these foods can help maintain adequate magnesium levels and consequently improve your sleep and reduce your anxiety. On the other hand, a diet rich in refined carbohydrates and sugars can do the opposite. This is because these foods can lead to increased excretion of magnesium by the body, effectively reducing its levels. Therefore, if you consume a lot of sweets, breads, and pastas made with refined flour and sugary drinks, you may be inadvertently compromising your magnesium levels. Moreover, lifestyle also plays a crucial role. High stress, excessive alcohol consumption, and certain medications can deplete the body's magnesium, increasing the need for greater care with diet or even supplementation. Therefore, taking stock of what you eat and how you live are essential steps to understand how to naturally improve your magnesium levels. This can not only help improve the quality of your sleep, but also your response to stress and anxiety. Let's discuss the role of vitamin B1, thiamine, in managing anxiety. This vitamin can be a great ally, especially if your anxiety does not seem to have an obvious cause. Vitamin B1 is essential for the body's energy metabolism and plays a crucial role in the functioning of the nervous system. A deficiency in B1 can result in anxiety symptoms, as it affects your body's ability to handle stress appropriately. People with a B1 deficiency often experience unbalanced breathing during anxiety episodes, where inhalation is not proportional to exhalation, leading to poor CO2 retention and consequently inadequate oxygenation of the cells. To combat this problem, supplementing with B1 can be extremely beneficial. A personal example: in my 20s, I consumed many refined carbohydrates, which not only depleted B1 from my body, but also contributed to my anxiety and restless leg syndrome. When I started supplementing with B1, I noticed a significant improvement not only in anxiety but also in the quality of my sleep, as my body could finally relax and slow down at night. If you are dealing with anxiety, in addition to considering B1 supplementation, it is also useful to practice breathing techniques that balance inhalation and exhalation. Breathing slowly through the nose, maintaining a constant rhythm, can help calm the mind and facilitate entry into the state of relaxation needed for good sleep. In addition, it is important to evaluate your diet to ensure that you are not consuming foods that deplete B1, such as refined carbohydrates and sugars, and that you are including foods rich in thiamine, such as whole grains, legumes, pork, and nuts. Another super important factor is about a fundamental hormone for regulating our sleep cycle and how exposure to blue light can affect its production, which is melatonin. This topic is especially relevant in the digital age we live in, surrounded by screens that emit blue light. Melatonin is naturally produced by our body when it starts to get dark, signaling that it's time to prepare for sleep. However, exposure to blue light, especially at night, can significantly interfere with the production of this hormone. This is because the blue light emitted by smartphone, tablet, and computer screens tricks our brain into thinking it's still day, which can reduce the production of melatonin and make it harder to fall asleep. The impact of this is clear. If you have the habit of using electronic devices before bedtime, you may be inadvertently harming your sleep. The good news is that there are simple measures that can help. For example, many devices now include a night mode that reduces blue light emission. Using glasses with blue light filters or installing apps that adjust the color and brightness of the screen according to the time of day are also good strategies. In addition to managing blue light exposure, considering other light sources can be beneficial. Infrared light, for example, which is more abundant at dawn and dusk, can help reinforce the natural sleep cycle, as it does not interfere with melatonin production. Spending more time outdoors during these times of day can, therefore, improve the quality of your sleep. Another interesting point is that, although melatonin supplements can help you fall asleep, they are not always effective in maintaining sleep throughout the night. Therefore, it is essential to investigate the underlying cause of melatonin deficiency, which is often related to lifestyle habits, such as light exposure habits. Then, you can take more informed steps to improve your sleep hygiene, reducing blue light exposure at night and increasing natural light exposure during the day. There are also two essential nutrients that work together to support various body functions, including sleep quality. Understanding this interaction can help you make more informed decisions about supplementation and diet. Magnesium and vitamin D have a symbiotic relationship. Magnesium helps activate vitamin D in the body, while vitamin D facilitates the absorption of magnesium in the intestines. This means that a deficiency in one of these nutrients can negatively impact the efficacy of the other. For example, even if you are consuming enough vitamin D, if you have a magnesium deficiency, vitamin D may not be activated properly, and vice versa. This dynamic is particularly important when we think about bone health and hormone regulation, but it also directly affects our sleep. Vitamin D has been associated with better sleep patterns, while magnesium is known for its properties that promote relaxation and reduce anxiety. If you are having trouble sleeping or often feel anxious, it is worth considering not only your magnesium intake, but also whether you are getting enough vitamin D. This can be through sun exposure, which is the most natural and effective source of vitamin D, or through supplementation, especially in places with long winters or for people who spend a lot of time indoors. In addition, if you decide to supplement, it is important to choose forms of magnesium and vitamin D that are well absorbed by the body. For example, magnesium glycinate is a form of magnesium that is particularly effective for relaxation and sleep health, while vitamin D3 is often recommended for its efficacy and ease of use by the body. With this understanding of the interaction between magnesium and vitamin D, you can better adjust your diet and supplementation to optimize both your overall health and your sleep pattern. We understand that although magnesium is often recommended for these issues, its efficacy may be limited depending on the underlying cause of the problems. We also address the importance of a balanced diet, rich in magnesium and vitamin B1, and how they can be powerful allies against stress and insomnia. This knowledge provides us with a solid foundation to better understand our body and the complex interactions that affect our mental and physical health. With this information, you are now better equipped to make informed choices that can not only improve your sleep quality, but also your overall quality of life. I encourage you to consider these variables when assessing your health and to always seek a balance that respects the unique needs of your body. Remember, the key to a healthy and fulfilling life may lie in the harmony between diet, supplementation, and lifestyle. I am here to help with whatever is necessary for you to achieve your wellness and health goals. And thus, we conclude on how to optimize your sleep and manage anxiety naturally and effectively. If you have more questions or need more information, I am available to help.